All right, looks like we're live. Gil, we're live on I think Facebook, LinkedIn, YouTube, and Twitter.
All right, I like that. I like the feeling of being live. Great.
Yeah, it's a different. It's certainly a different feeling of yeah. Hopefully, I've set this up right. But if you are watching us on any of those channels, just do us a favor and shoot us a comment saying you're watching, and if you have any questions, feel free to ask us. What we're going to try and do today, I think, Gil, is maybe touch on a couple of topics that we often um, talk about with our customers at HIPAA Vault. Maybe a little bit on, well, definitely a lot on HIPAA because that is what we're all about. But maybe as well a couple of current topics as well. Does that sound good?
Yeah, that sounds great. I really like the doing things live like this because when you're doing podcasts, sometimes it seems like a lecture, and this is going to be a little bit more entertaining, I hope.
Fingers crossed. Yeah. So one thing I had to talk about is when it comes to HIPAA, what's at stake. So obviously, for those of you that don't know that are watching, HIPAA stands for Health Insurance Portability and Accountability Act. So there's a lot of words there. It's a law, a federal law in the U.S. established in 1996. It was passed into law, and it's been updated ever since. So I think, what are we now? October. So it was passed in August 1996. So we're past 27 years of it being in effect now. I think Gil, you know obviously a lot more about this than me, but I think the idea was health insurance portability. So the one of the reasons the law came about is because when a patient was looking to move from one insurance provider to another, they wanted to make sure there was a safe mechanism for moving their information because there was a lot of sensitive information there. They wanted to make sure, the government wants to make sure that there was a responsible way and secure way to facilitate that, right?
Yeah, you're right about that. That was the original impetus behind that. They want to be able to move your data and then also ensure that the guardians of your patient information were doing a good job because there were a lot of data was leaked out, and after HIPAA regulations came in, everyone knew that was handling data that this was important, but there weren't really any fines or anything. It was just like, okay, I'm supposed to do this, but what if I don't? What's the risk? Well, there wasn't much risk. So then the high tech um, omnibus came around, and that one, as they say, put teeth into the HIPAA regulations. That means that, hey, now you can get fined. And that's something that I want to talk about because
Okay.
everybody knows it's important. Nobody wants a breach. I mean, that's obvious, right? None of our customers want a breach. They're all like, hey, this data is important, keep it safe. I don't want to get sued, very high level. And so that's good. That's really important. But I want to make sure that our audience, those that are involved with HIPAA data, can at the back of the napkin just really quick, like, okay, if I did get in a lawsuit, what would it cost me? Do I have enough insurance to cover this, cyber insurance and all that? So really easy math. What you can do is, let's say that your app that you've created or that you're hosting somewhere in the cloud has a breach. Okay, so step number one, there's a breach. So there's unauthorized access. And you know that in your app, there's 1,000 patient records. So that's 1,000 different patients. So you say, okay, that's 1,000. And then if there is a breach, typically what happens is that you have to purchase for every patient, you have to purchase what's called identity protection. That's a service, third party service, where they'll keep an eye and find out if any of that data is being abused out in the wild.
Is that different to cyber security insurance?
Yeah, this is completely different than insurance. This is what a judgment would usually require is that, okay, you had a breach, you told your customers, your users of your app, I'm sorry for the breach. You send them an announcement. But besides saying you're sorry, you have to get them typically this identity awareness license, this identity. what do they call it? Identity theft applications that will basically notify you anytime your data is being used out in the wild. And that could be, the bad guy that stole it, maybe selling your info or whatever, is being abused, and they send you notifications so that you're aware. So anyway, this kind of service normally would cost, if you went out to retail, let's say you went out and you said, okay, I'm going to buy this package for identity awareness, and it's going to cost, say, $25 for the year. And you have to get it for at least 2 years. So now you're at $50. And you have 1,000 patients. So you take 50 times 1,000. You say, well, it's going to cost me $50,000. That's what you would be up against. Now, of course, if a patient sued you for more money, that's different. I'm just talking about the standard practice, what you would have to do at the minimum. So you're going to be spending $50,000.
Is this what you'd have to do if a breach occurs?
Yeah, this is what you'd have to do if a breach occurred. Okay. You're aware of the breach, and now you're notifying all your customers and say, hey, Mr. Customer, for you, because there was a breach and we don't know what the bad guys are doing with your data, we're going to buy this identity tracking application. And right now it escapes me. Like, I don't remember the exact nomenclature for the, for that industry, but it's essentially identity tracking. Thanks for looking that up.
Yeah.
Anyway, so that's for 1,000 records. Now that's 50,000. Now add another zero. Say instead of 1,000, say it was 10,000.
Why are we adding a zero?
Because let's say that your app.
10,000. Okay.
Yeah, let's say you had 10,000. Your app's grown and you're successful. You have 10,000 users, and you have 10,000 different patients. So now you're at 500,000. It's going to cost you $500,000.
There's a big one that's coming up for me. Were you looking for the name of an identity monitoring?
Well, to give an example, yes, but just the sort of the industry word for that type.
Yeah, identity monitoring services.
Okay, I was close, but it's identity monitoring service. So that's what we're talking about. So again, if you had 10,000 records, Adam, it's going to cost $500,000, and so that's why you want insurance. You want to be able to have the insurance so that if you have to pay for this identity monitoring, you don't have to pay out of pocket. You can go to the insurance company. You have a deductible. Maybe your deductible is $10,000, but hey, now you're only paying $490,000. I mean, the insurance company pays $490,000 and you pay $10,000. Now, I do want to add one more thing to this, Adam, because let's say that you do have like 10,000 or even 100,000. Let's say you have a big app. You have 100,000 patients in there, maybe. You're very successful. Now, if you added another zero, instead of 500,000, now it's 5 million you'd have to pay just for the identity monitoring, because you have to go to the identity monitoring company and buy all those licenses from them. Yeah. So what's happened in the industry, because these unfortunately, there's all these hacks, man. They're happening all the time. And just look at the HIPAA news. There's every week there's a new breach. So if the volume is big enough, then you could go to a broker or negotiate directly with the identity monitoring company and say, hey, I'm going to buy a lot of licenses from you all at one time. And they'll say, oh, well, instead of $25 per user per year, it's going to cost you, you can get it down to as low as $4, I heard. So that's a lot less than $25. But then you have to know what you're doing. I mean, either the insurance company may know how to negotiate that, or you'd have to find somebody that really knows, how to play that game so you can get the lowest fee. And of course, if you let them know you're desperate, they probably say, oh, too bad, you have to pay. But if you have somebody negotiating on your behalf where you know what you're doing, then you can drive that fee. But I would say the retail cost is about $25, at least the last time I checked, and then the wholesale price is probably half of that, so maybe more closer to $10 or $12 per patient per year. Yeah. So anyway, again, circling back, it's like, well, who cares? Like, why do I care about this? I just want to avoid getting sued. I go to HIPAA Vault. That's our company to be secure. I mean, yeah, sure. You don't want to be thinking about that every day, but you do need to be prepared, right? You have to go to your insurance company. You have to know, like, okay, how much insurance do I need, right? So this is a great way for you to do the quick back of the napkin math And then you go to your cyber insurance company and you say, look, I need this much insurance. And maybe you're overbuying. Hey, we might be saving you some money. I mean, maybe you're like, oh crap, I've been spending, I've been buying $5 million a policy, insurance policy of 5 million. I don't need 5 million. I only need, 2 million. So you could be saving a lot of money there if you can right size your insurance.
That's interesting. I've got a question that's just come up because at the start of that, you said that the scenario that you put forward was, a healthcare company that had a web application that got hacked and data was breached. Does it make a difference what the web application was? Like if the question is twofold actually. So the first one is if that company, if the web application was like a proprietary software licensed by a software company, does the risk vary there in terms of how much the software company would take in terms of liability versus the healthcare company? Is there anything there?
Well, let's say, yeah, I think I see what you mean. Let's say that the company, a company, has created their own healthcare application.
Yeah.
Right. They created it. They went and hired a team, and they were responsible for the whole thing. So in that case, that company's on the hook for any liability because they wrote it. But if instead of that scenario, which is not uncommon, where instead of writing your software, let's say that the healthcare app is using some kind of open source software, like for example, WordPress. WordPress is an open source, and so they're using that third party. Then they're still on the hook for everything because it's an open source. There's nobody to go to sue. But if you're using, let's say, a commercial product, something that you bought or pay a license for, that's part of your solution that you're offering, well, now, as they say, what rolls downhill, right? So if you get sued or you have to pay all this money, you can go to your software company that you're licensing. Hey, there was a breach in the software and I bought the software from you.
Yeah.
And so now basically you would be suing that software company to try to recover some of the damages.
Yeah.
So that's how it works.
Not to get too much into the weeds, but I would have thought that depending on when the vulnerability was detected by the software company, let's say if the vulnerability was detected today and the software company acted quickly and said, hey, we've got an update for the vulnerability, make sure to update. And let's say the company that was using the software didn't update for a year, then probably the software company would likely claim that they're not responsible for anything after today.
Well, sure. Yeah, and that's a good thing to talk about for a little bit. So the software vendor would say, hey, look, guys, I told you to update the software and you didn't bother doing it. So that's probably, and we could do another live session and talk about that. But just to cover it briefly, that is something important. You have to keep the software up to date. When I say the software, I mean an application may be comprised of many different pieces of software.
Layers,
different layers, different software. They all work together. Like a database software works with the web application software, which works with a third-party API. I mean, who knows? You got all the software that you're licensing. All of that together is your application that you offer to your healthcare community. And it's the obligation of the business manager to keep that software up to date, to make sure it's at the latest secure version. And so, if you go to the software vendor and say, oh, you cried at them, hey, it's your fault, look what you guys did to me, they're just going to say, no, I don't think so. I mean, you got to be on top of it. You got to be updating the software.
Okay.
So, so I think in this session, I like this because I think we covered some very important things. One is, well, how do you estimate what your liability is for based on the number of patients that your healthcare application handles? And then number two, what do you do with that info? Well, you adjust your insurance accordingly to right size it. And then thirdly, make sure you keep all your software up to date. I mean, these topics that we're covering are very, very important, and they give the business manager, who may not be technical, what they need to know at a high level. Like, okay, I better do these things. And it's something they can do. They can meet with their team and simply say, hey, let's make sure we're on the latest version. And the business manager should be doing that, Adam. In my opinion, they should be going in there and seeing, hey, what version am I on? And then go to the vendor and say, hey, what version do they think, we should be on? And then compare the two numbers and go, oh, we're behind. So that's something a business manager should be doing. This isn't all up to the tech guys.
So this is like a check and verify kind of.
This is like you might say, no, I trust my team, Gil.
Yeah.
I try. Well, you know what the phrase is? Trust and verify.
That's it. Trust and verify.
Trust and verify. I know you trust them. That's great. We'll verify it. Yeah.
Great. Was there anything else you wanted to talk about? I know we like to usually give the listener as much value as possible. Do you have like one top tip that you could like to simplify it down, something that a listener and viewer could go and implement today?
I would just want to just reiterate what I said. I mean, ensure that all the software, let's call it the software stack, because it's multiple layers. Make sure the software stack is at the latest, most secure version. And that includes the operating system all the way up through your application. There's lots of moving pieces. And just basically make a list and say, well, I know I'm using 8 pieces of software from 8 different vendors or something, and just say, okay, what version is each one on? And once you have that in your pocket, then it's easy for you to check. Maybe every quarter you check. It'd take you 10 minutes. And so you as a manager would be that would be unusual. I don't think most business managers do that. They just let their tech team, they rely on their tech team to do that. And if the tech team isn't on top of all that, then they're going to regret it. They're saying, oh man, that's something I should have been doing.
Yeah.
And keep in mind, Adam, the tech teams, if there's a lawsuit, the tech team's not paying anything. They have a wages and a salary that's not up to them to pay the bill. So that's why the business owner, business management team should be the one that really is monitoring that, because they have the greatest stake, right? They're the biggest stakeholders, and they have the most at stake.
Awesome. Yeah. So trust and verify. And the top tip would be to make sure that your software is updated to the latest stable version.
Mm-hmm, mm-hmm. I guess we could leave them with one analogy. If any of our audience has kids and they say, well, I gave my kids a curfew. They have to be in bed. They're teenagers. And I told them they can stay out with their friends till 11 p.m. So you as a parent, what do? Do you just go to bed at 9 and you just wake up the next morning? Or do you kind of peek into the door, open the door at 11:15, see if they're in there? Yeah. Trust and verify.
Awesome. Gil, I think that's that should be enough for this one.
Sure. Yeah, sounds great. Well, it's enjoyable, Adam, and looking forward to the next session.
Yeah, absolutely. Thank you for joining us. And if you have any follow-up questions, feel free to reach out to us through our website at HIPAAVault.com, or you can email us at podcast@HIPAAVault.com as well. And we'd be happy to answer any questions and get on a call with you as well. So thanks for watching, and goodbye for now.